All right, good afternoon. I'm Allison Scobber, Consolidated Planning Group, and today we are super excited to be here with our special guest, Andy Hardwick, Public Affairs Specialist with the Social Security Administration, and we've done many presentations with Andy, and a lot of the presentations that we've done have really been focused on families that have a special needs child. But today we're talking about Social Security as it relates to your retirement and all of the questions that you may have with that today. Consolidated Planning Group is a holistic financial planning firm, and we really work with families and sit down with you as it relates to your retirement planning. We're able to help do a complete financial plan, able to help you forecast kind of what it's going to look like, what is the time frame that you should be looking at. So if you have needs, and need some help with that, certainly reach out to us. Today, you guys are in a mute stage, and as you are going through this presentation today and you have questions, if you'll just please put your questions in the chat box, and we aim to answer as many questions as we possibly can today. So thank you so much for being here. If you're registered for this event and you have to jump off a little bit early or what have you, this event is being recorded, and with your registration, you will get an email with today's slides and the presentation. So thanks so much. And Andy, I'm going to turn it over to you.
Thank you very much. Thank you for inviting me out today. My name is Andy Hardwick. I'm Public Affairs Specialist for Social Security. And today we're going to be talking about Social Security. I would like to tell you that at this time, all Social Security offices are closed to the public. So right now, your only option about doing business with Social Security is either online by going to our website, www.socialsecurity.gov, or you could put ssa.gov instead. Either one will work. And a lot of our services are available online, or you can call us by phone. Now, you could call at the national 1-800 number, 772-1213, but a better option is to go to our website, and down below where it says, the icon says contact us, click on that. And next to the office locator, put in your zip code, and you will get the phone number of your local office. Now, most of us are working from home, so your phone call will be taken by somebody, some employee from, assuming you live in Fort Bend County, from the Stancliffe office, and they will give you the same level of service that you got before. Okay, so you can file a claim either by phone or online. And that's just the way, I have no idea when the offices will open up again. So we'll just have to see. But in the meantime, those are the two options that you have. Okay. The popular conception of Social Security is it's a program for older people. Yes, it is. That's one of the designations for Social Security. Actually, the formal name for Social Security is RSDI, Retirement Survivor Disability Insurance. So we actually have 3 programs. We help you if you make it to time for retirement intact without any problems. We have retirement benefits. Should something happen to you, your widow or widower and your children can also be protected under survivor benefits. Disability benefits, should you become able to work because of a physical or mental condition that's going to keep you out of work at least a year, you could get disability benefits. Disability pays you the same as though you were full retirement age. So all of these are Social Security benefits, but they're just in a different category. Now, in order to get Social Security retirement when you become of age, and right now the minimum age is still 62, you need to have earned enough credits. You may be familiar with the older term quarters, okay? But quarters, credits, it means the same thing. So for this year, in order to earn 1 credit or quarter, you need to make gross $1,410 at least. Now you see 1,470 on your screens. That's because I'm giving you the 2021 figures. Okay, we're already at the end of October. We've only got 2 months to go before 2021 begins. So, but this year it's 1,410. So for every 1,410 you earn, up to whatever 4 times 1,410 is, you can get, well, you can get up to four credits. So once you get 5,000, whatever, roughly about $5,600, then you would get your 4 credits for the year. Even if you earn this year $100,000, you're not going to get more than 4 credits. 4 credits is the maximum amount you can get per year. So for next year, it's 1,470. Whether that takes you a week or a month, doesn't matter. You earn credits. Now, once you reach 5,880, which could be in your case in a month, maybe at the end of January, you've already made $5,880 gross for the month. Well, guess what? You've already earned your 4 credits for the year. You're not going to get any more credits. Now, this is not determining how much Social Security you're going to get. This is determining, can you get Social Security? So even if I had a job where I was earning $100,000 a year and I worked for 9 years, 4 credits per year after 9 years, I would have 36 credits. Would I have enough to collect Social Security? No. I'd still be 4 credits short. So what I would need is work one, well, it doesn't have to be a year. I could work 1 month. As long as I earned $5,880 gross at that point, then I would get those 4 extra credits that I needed to make up 40 credits. So over your working lifetime, you need to have 40 credits. So sometimes people ask me, well, suppose like I worked for 5 years and then I stopped, and then 5 years later I stay. That's okay. It doesn't have to be 1 year after the other. So it could be, you could get 2 credits in 1 year, no credits in another, 4 credits in another. As long as over your working lifetime, it adds up to 40 credits, you're good. So as I told you before, you can retire at 62. However, if you retire at 62, your Social Security benefit is going to be reduced. Why? Because you're taking benefits what we call early, and by taking benefits early, you're going to get more checks. If my full retirement age is 66, but I decide to file early for retirement at 62, I'm filing 4 years early, right? So assuming I get 12 checks per year, 12 times 4 is 48. I get 48 extra checks, right? So because I'm getting more checks, my checks are reduced. And when I reach full retirement age, that doesn't change. So let me give you an example. Let's assume that my full retirement age is 66 and my benefit of 66 is $1,000 a month. If I choose to take benefits at 62, my benefit will be reduced to about $750 a month. So I'll get about a 25% reduction, right? Now, if I wait to my full retirement age to get benefits, to file for benefits, then I get 100% of my benefit based on what I was making when I was working. So, you know, that could vary depending on your work history. Now, this last category here says you can get an even higher benefit if you don't take benefits at your full retirement age, but you wait to take them later. If you choose to delay taking your Social Security benefits before, or I should say after your full retirement age, for every year you delay taking those benefits between your full retirement age and age 70, your benefit goes up by 8%. So using again the example of $1,000 a month benefit at my full retirement age, let's say it's 66. Let's say I decided to file for benefits at 67. That $1,000 a month benefit would be $7,080. If I delayed taking retirement until 70, because your benefits don't go up by delaying past age 70, then that same $1,000 benefit a month would be $1,320 a month. So at 62, that would be $750 a month. at $71,320. Now, when you're age 60, you may think, wow, wait 10 years. I'm not going to wait 10 years. But as you get closer to your full retirement age, maybe when you get to 66, if that's your full retirement age, you may say, well, 4 more years, not a big deal. I got good health. I'll take my chances. I don't need the money right now because I'm working or I got a good income. So it depends. There is no one answer fits all. I will tell you this, though. There's a caveat that if you take Social Security retirement benefits before your full retirement age, before you turn your full retirement age, and that's going to be anywhere between 66 and 67 for most folks. If you take it before and you're still working, your Social Security benefit could be cut if you're collecting benefits and working and you're not yet full retirement age, because there is a limit on how much money you can earn from wages. So you got to be careful of that. Now,
can you talk a little bit more about that? Because we actually just have a question in the chat box about that.
I'm going to get to that. We have a slide on that. So
Okay,
once you
perfect.
reach full retirement age, there's no limit at all. And I will, in a few minutes, I'll talk about the limits and how that could affect your Social Security. Okay. Now, if you are collecting benefits, your spouse can file under you for spousal benefits. Okay, even if they have never worked, right? Now, but your spouse has to be at least 62. So if you're receiving benefits, your spouse can file under you at 62. If your spouse is not yet 62, but caring for children under 16, that spouse could get benefits under you at any age until the youngest child in the house turns 16. Also, if your spouse is caring for children with disabilities, they also might be able to get benefits. Now, you have to understand, if your spouse is not yet full retirement age, caring for these kids, all right, if they're working, that could have an impact on them getting Social Security benefits under you until they turn full retirement age. Because remember, until you turn full retirement age, if you're working, your earnings still count against your Social Security. Now, your children can get benefits until age 18 or 19 if they're in high school. If they have a serious disability, they could get benefits past that, all right, if their disability began before age 22. So you could have a child that's 25 years old, 29 years old when you start getting benefits. As long as that child is single and unable to work because of his or her disability, and you can prove through medical evidence that that disability began before age 22, they could get benefits under you. All right, ex-spouses. We all know that all marriages are perfect and never end. And unfortunately, that's not the case. All right. So if you were married before, married at least 10 years, divorced at least 2 years, and have not remarried, that's important, you can file under your ex. Now, I told you, in order for, if you're still married to your spouse, in order for you to get benefits under him or her, they have to be collecting. Not so in the case of divorced spouses. If you are filing under an ex, they don't have to be collecting in order for you to file under them. That they just have to be at least 60.
Your mic went out, Andy. We can't hear you.
If you're the one that's filing, you cannot have remarried. But if they remarried, it doesn't matter. Well, does the fact that you're filing impact their benefits or the benefits of their other spouse? No, it does not. Can they unfriend you and say, I don't want my ex to collect benefits under me? No, they cannot. Okay. So that's just something that, to keep in mind.
In the event that the ex is deceased, if they were married over 10 years, could they still collect off of the deceased?
Yes, they can. And we're getting to that. The most you can get as a spouse or an ex-spouse is an amount equal to 50% of what they get. However, as a widow or divorced widow, you could get an amount equal to 100% of what their benefit. Well, what if there's another widow? It doesn't matter. Both of you get the same thing. Okay. So while your spouse or ex is alive, the most you can get is an amount equal to 1/2 of what they get. That does not reduce their benefits, but you just get an amount equal to what they get. But once they die, then that changes. So you could be getting one benefit and then they pass away and then that benefit is increased because you are switched over from spouses or ex-spouses to widows or divorced widows benefits. Now, previously, if you filed for, because I just told you that if you delay taking your own benefits till age 70, you could get, potentially, depending on your full retirement age, anywhere from 124 to 132% of your benefit, of your full benefit. But, and up to recently, if you were full retirement age and your spouse was collecting benefits, you could file under your spouse and collect spousal benefits and wait to take your own at age 70. All right. But the rule previously was that if you were not yet full retirement age and you went to file for spousal benefits, we made you file for your own also, your own reduced benefits, and you got whichever one was higher. Now that rule has changed. Okay. Now you can file, this is called a restricted application, meaning you just want one type of benefit, not the other. So if you are full retirement age, all right, 66 or 67 or somewhere in between, whatever your full retirement age is, and your spouse is collecting, you can file under your spouse a restricted application if this is important, if you were born before January 2nd, 1954, all right? If you're born January 2nd, 1954 or later, even if you're full retirement age, whenever you go to file for spousal benefits, Social Security is going to make you file for your own and give you whichever one is higher, right? So that's a change, because before, if you were full retirement age, you could, no matter when you were born, you could do that. You could do the restricted application, but now you can only do that restricted application where you just want a spousal and you want to leave your own alone, your own benefit alone, so it'll grow higher. If you were born before January 2nd, 1954. Now, this, as you see by this slide here, it does not apply to widow or widowers. You can get a widow or widower's benefit as early as 60. Now, remember, if you're working, that might have an impact on your ability to collect benefits until you reach full retirement age. But if you do file for widow's benefits or widow's benefits early, like at 60, 61, then we're not going to make you file for your own benefit also. We'll just give you benefits under your deceased spouse, and then you can take your own benefits at 70 if that's what you want. All right, so I've been talking about full retirement age. Here's the chart which explains how old you have to be to reach full retirement age. So basically, anybody born between 43 and 54, it's 66. Between 55 and 59, it's 66 in 2 months, 4 months, 6 months, and so on. Anybody born 1960 or later, your full retirement age is 67. Nobody has a full retirement age higher than 67. Okay, so.
Can you answer, like, is there a percentage amount that a widow can get on a spousal benefit at age 60 versus 62?
71.5% at age 60. That's what a widow or widower collects if you file. If you wait to full retirement age, you get 100%. Now, suppose you take it at 62 or 61, then it'll probably be about maybe 73%. At 60, 62, maybe 80%. And so it goes up. It's the same thing with the early retirement. If I take early retirement at 62, then my benefit is I get about a 25% cut. So I get about 75% of my benefit. But if my full retirement age is 66 and I take benefits at 65, then I would get about 90% of my benefit. So the closer you are to full retirement age, of course, the less of a cut you get. All right. Now, even if you get a cut, there are ways to increase your benefit. If you, for instance, continue working or stay or get a job after you start collecting benefits, you could make your benefits go higher. Okay, if you're collecting your own, if you're receiving your own benefits, you could make it, you could cause an increase in your benefits. And I'll talk about that in a minute. So
I actually have one other
Okay.
question on a spousal widow benefit. If the father passed away when the child was 7, can you give an example of that? In the example of both marriage and not married, if it was a child's father, the child is not disabled.
Okay. Well, if the parents were not married, then assuming it was a dad that passed away, the mom does not have, because they weren't married, she cannot get any benefits. The child, though, can get benefits until age 18. And if the child is still in high school, they can actually get benefits up until 19. They can get benefits past that if they have a serious disability, but otherwise they normally stop at 18 or 19. No disability has to be proved. Any child, any minor child under 18, whose parent is collecting retirement benefits can receive benefits under their parent who's collecting. And that doesn't reduce the parent's benefit at all, just by virtue of being a minor child. And then the parents don't have to be married. Now, if the parents were married and or are married, and the mom is caring for the child, even though the mom, if we're talking about widow's benefits, the mom normally has to be at least 60, but since she is caring for a child under 16, she would actually receive benefits until that child turns 16. And then at that point, if she were not at least 60 years old, her benefits would stop, and then she could refile for widow's benefits at 60 or wait to full retirement age to collect them. Now, in order to calculate how much Social Security you're going to get, we use your highest 35 years. Now, this is kind of can be confusing sometimes, because I told you earlier in the presentation, excuse me, that you needed 10 years or 40 credits. That's true. If I maybe came from someplace else or even lived here all my life and I only worked 10 years and I got those 40 credits and then I stopped working, never went back to work again, that's okay. I have the minimum necessary to collect Social Security. I'm going to get Social Security. But when Social Security does those calculations, because I don't have 35 years, there's going to be 0 years in there, like 25 years if I only work 10 years, where that's going to have an impact on my monthly benefit. It's going to be reduced slightly because of those 0 years, right? So if I have 30 years of work when I retire, when I request benefits from Social Security, Social Security is going to use all 30. If I have 40, they're going to use the highest 35. All right. So a lot of times women and men maybe earn the same amount of money, but the woman ends up getting less. How come that happens? Well, because probably, I don't know if that's going to be true in the near future, because things have changed. But, you know, in the ancient times when I was growing up, a lot of times, you know, women stayed at home, cared for the kids. And I think more and more women are doing that. So let's say a woman stays at home when the kids are real small. And so when she retires, she has 30 years of work. Her husband has his 35 years. Okay. So she has 5 years of zero. That's going to reduce her benefits slightly. The good news is, if she keeps working or she gets a job, every year she keeps working, we take a 0 year out and put in what she made for the year and recalculate the benefit. Or even if she has the 35 years, if she's still working or gets a job and what she made for the year is higher than one of the 35 years we used, or one of the 35 years is a 0, we'll take that out and put in what she made for the year and recalculate the benefits. And that happens, that's for everybody. And that doesn't stop at 70. That goes on forever and ever. So as long as you're working, at the end of the year, we're always going to look and see if what you made is higher than one of those 35 years, or one of those 35 years is 0. So if it is, we will recalculate your benefit, and that will go on forever and ever. All right, so let's talk about this. Windfall elimination provision. What the heck is this? Let me tell you, teachers, I feel your pain. My wife is a retired teacher, so she's subject to this. If you work for an organization that does not pay into Social Security, right? City of Sugar Land, County of Galveston, most school districts under teacher retirement, your Social Security is going to be calculated in a different way. You're going to end up getting a little bit less. This is called the windfall elimination provision. Of course, if you worked all the time for a school district that did take out Social Security, or worked at a university, four-year university, which is under TRS, but does pay into Social Security, or at the medical center, which is under TRS and does pay into Social Security, then you're not affected by this. But if you work for a school district that did not take out Social Security, then your Social Security benefits are going to be calculated in a different way. That's called the windfall elimination provision. Unless you have 30 years of substantial earnings in a job that paid into Social Security, then you might be completely free of this windfall provision. But in a lot of cases, you're not. If you're getting a pension from a place that, like City of Missouri City, or City of Houston, County of Fort Bend, or Harris County, which pays into Social Security, we don't care what your pension amount is. That will not affect your Social Security amount at all. All right, so you don't have to worry about it. It's only if you get a pension from a place that did not pay into Social Security. Okay.
I want to ask a question on that
Yeah,
really quickly. So in the example, if you have 40 working quarters outside of TRS, and then you go to work for TRS, but you've got your quarters, so then is there an offset or not?
There is, because remember, in order for you to reduce the amount of this windfall being counted against your Social Security, you have to have over 20 years of substantial earnings. And if you have, it doesn't go away completely until you have 30 years of substantial earnings. Then the windfall does not apply. Allison, by you having 10 years, that just enables you to get Social Security. Okay. So, but that doesn't make you free from the windfall. So the windfall assumes that you are eligible for Social Security. So it's that you have those 40 credits, because otherwise you wouldn't have to worry about this, because you wouldn't be getting Social Security, at least not your own benefits. Okay. So this is for those that are getting their Social Security, that have worked at least 10 years in a job paying into Social Security, but are also eligible for pension from a place that did not take out Social Security. So that's
in that example, because we get this a lot, and I know that there may be, a lot of people on here that are not affected by this windfall provision. I get a lot of questions frequently. Is there any way around this? So one of the questions that I get, Andy, is what if I take my lump sum pension and I roll it out into an annuity? So if I take a lump sum pension from TRS, instead of getting a monthly stipend or a monthly pension, like a lot of people take, people ask if they could roll the money out into an outside annuity, and then would that, make them eligible for their Social Security benefit? Can you talk about that for a moment?
All I know is the moment you are eligible to take out your TRS, the money that's in TRS, okay, that money will be prorated, that lump sum, and you will be subject to the windfall elimination provision. Okay. Now, the other way around it is, if you work for TRS very few years, and you're not really going to get a high, just a dinky little pension, then you might as well, then you could take, if you only take your contributions to the pension fund, you take your contributions out, then you wouldn't be subject to the windfall. Now, his name, I forget his name, the congressman from the Woodlands. Several times he's attempted to introduce legislation to amend this windfall, but it hasn't had much movement. So I don't know what to tell you, but I would say contact your congressman's office and find out, this may be changed sometime in the near future, but so it probably will in your favor. But right now it's went to some kind of committee and it hasn't come out, so nobody's voted on it, and I don't know. So, squeaky wheel gets the grease. Contact your congressperson and say, like, what are you doing for people that are affected by this? Are you voting on this legislation? What is your position, and what do you think about this? So,
So,
I mean,
Andy,
go ahead.
In this example, so let's say for a moment, I want to give an example of like how this would be like used against them. So let's say for a moment that their pension amount is $2,000 a month and their Social Security benefit amount is $1,000 a month. So in that example, because their pension amount is far greater than they would get zero from a Social Security perspective, or not?
No.
How
Because
is that
again,
work?
I'll use my wife as an example. She's getting Social Security, all right, because she has her credits, and the amount of her, it's not the amount of her pension per se. What it is it's just that her Social Security is being calculated in a different way. So anybody who works, who's eligible for a pension from a place that didn't pay out Social Security, but also that has a minimum of 40 credits or quarters, they are always going to get their Social Security. Your Social Security will never be reduced to zero. Okay, so you're always going to get it. Let me just tell you this, Allison. Anybody who's listening to me, if you're subject to this we have a WEP calculator online. So if you go to our website, socialsecurity.gov or ssa.gov, use one of those calculators, a WEP calculator, and it will tell you what you're actually going to get if you're subject to the WEP. Okay. Now, the other goodie is a government pension offset. Remember, I told you that a spouse can get an amount equal to 1/2 of what their husband or wife gets if they're full retirement age when they file. Well, guess what? If that spouse who's filing under their spouse who's collecting Social Security happens to get one of these pensions from a place that didn't pay into Social Security, they're subject to the government pension, or their spousal benefit is subject to the government pension offset. What that means is that two-thirds of their pension from that place that did not pay into Social Security counts against any spousal pension they could get. So, excuse me, let's assume my wife is getting $2,000 a month from Social Security. At full retirement age, I expect to file under her and get $1,000 a month. Cool. But I happen to be a retired teacher and my TRS pension is $3,000 a month. Well, if Social Security is going to count 2/3 of that, or 2,000 subtracted from the 1,000 I could get as a spouse under my wife is a minus 1,000. So what do I get as a spouse from Social Security? Nothing. All right. If my wife passes away as a widower, I could potentially get 100% of her benefit, which is $2,000 a month. But if I'm getting a TRS pension of 3,000 and they're counting again that 2/3 of it are 2,000 from 2,000, I still get nothing as a widower. The only way around this one is if the last 5 years before I retire, I work for a place under TRS that does pay into Social Security, then I would not be subject to this. So how would that work? Well, if I got a job, let's say the last 5 years I was working under TRS, I got a job at a 4-year university. They take out Social Security. So if the last 5 years before I retired, I was still under TRS, but in a, at working for a 4-year university where Social Security was being taken out, then the government pension offset would not apply. All right. Or if I went to work at the medical center, which you say, medical center, that has nothing to do with teaching. The medical center is technically under the University of Texas. All right. So, which is a 4-year university, 4-year institution. So therefore, if I were working under TRS, but the last 5 years, I got a job at the medical center, since it's still under TRS, because it has to be under the same retirement system. Okay, can't be any old job. So it's still on, since medical centers under TRS, last 5 years, I would not be subject to the government pension offset. Okay, so that's the way that works. All right, let me talk about my Social Security accounts. My Social Security account is a way that you can look into your work record. Well, you say, well, I get that letter from Baltimore once a year. Yeah, if you're 60 years old or older, you may have noticed if you're younger that that letter is not coming anymore. So if you want to look at your work record, why is that important? Because your future Social Security checks depend on what's on there, that wage, your wage history. So if that's wrong, you may get cheated out of Social Security. You don't want that. So you want to check that at least once a year. So how do you do that? Open up a My Social Security account, which you can do online at our website. So if you're at least 18 years old, have a valid email address, Social Security number, US mailing address, you can open up a My Social Security account. If you have any problems with a My Social Security account, okay, the normal procedure is, if we can help you by phone, is to ask you to come into the office. But of course, that's not possible right now because all offices are closed. So you might have to wait if you have any difficulty. Now, if you have frozen your account for some reason, because there was some abuse of your credit and you froze, then you won't be able to set up a My Social Security account until you unfreeze your information online. Okay, now if you have one of these accounts, not only can you look at your work history, but if you need a replacement Social Security card and you're not changing your name, you can request it through your account and it'll be sent to your home in about 2 or 3 weeks. If you have a Medicare card and you need a new one because your old one is in bad shape or you don't know where you put it, you can request it through your My Social Security account and it'll come to your home in 30 days. If you are on benefits and you need a benefit letter, a verification letter, you can download that instantly. If you're on benefits and you need to change your address, phone number, banks where your checks go, you can do all that through your My Social Security account. So, why we're trying to make it easier for you, to make it so you don't have to call us every time you want to do business with Social Security.
In the example that someone gets locked out, which I've heard multiple times in the past, that they had to go down to the office. Now that the office is closed, is there another way that they're unlocking people's accounts now?
No.
Okay.
The only, even though the offices are closed for extreme emergency cases, you could have an interview at the office, but it's very rare. It has to be something like you didn't get your checks and you need to get, a replacement check or something, and it requires an interview. Then you would have to make an appointment. You'd go to our website, and after you click on Contact Us in the office locator, you put your zip code and you call that office. That's calling the employees of your local Social Security office, and they could make an appointment for you to meet with somebody at Social Security. Now, It's very important. If you just say you're going by yourself, you can't take anybody with you. But if you need somebody, your son, daughter, some relative, you need to say who that person is, because you'll be asked at the door, who is that person that's there with you? And if we don't have their name on there as being listed as coming with you, they will not let you in. All right. So, but again, you can only come in by appointment. You have to explain what the situation is, and they'll be able to tell you if they can arrange for like an emergency interview for you at the office. But otherwise, just consider that the offices are closed nationwide. Okay.
We
Now,
have a couple of other questions that I'd like to
Okay.
just go over with you really quick.
Okay.
Can you talk about the maximum and minimum? There's a question on what is the maximum amount?
Social Security,
Yes.
probably about $3,200. I don't know what the minimum is. I guess it could be anything. Could be $40 a month.
Okay.
So, but the maximum is about $32,000. I'm sorry, my mind, $3,100 or $3,200, not 30,000.
Okay. Yes.
No.
Yes.
Yeah, that's the maximum right now, and you'd almost have to be like a CEO to get that amount of money. So
Sure.
yeah.
Okay. So then I hear, what if a person waits to file at age 70 and then he dies?
Well, hope he left a widow on the record or something, because if he didn't, then that money is, then that money is, the money in the Social Security Trust Fund is like a pool. It's not a personal bank account. All right. So it's not, hopefully the widow or widower can collect under that deceased person's account. But if they can't, now, if the widow or widower is getting more money than the deceased was getting, or than the deceased was due, then there's no change in the amount that the widow or widower gets. If they're like, if they were getting their own benefits. If I was getting my own benefits, and let's say I was getting $2,400 a month, my wife would have been due, let's say $2,200 a month. If she passes away first, I don't get anything because my benefit is higher than hers. If I pass away first, if my benefit is $2,400 and hers is $2,200, she gets the difference between mine and hers. So she gets $200 more. So her benefit equals mine, or what mine would have been prior to my death. Right.
So,
some people
but
think
also
that,
in this example, though, if a person has a disabled child, then the disabled child would be eligible for a benefit. The widowed spouse, in the example that the widowed spouse benefit was less, they would be entitled to 50% up to the family maximum.
Right.
But in that example, so in it, and this was something that came across my desk last week, if a person delays taking their Social Security, so if their full Social Security age is 67, and they delay taking it till 70 because they think that higher benefit, it'll be 50% of that higher benefit at age 70 for their disabled child or their widow. Can you talk about that? Isn't it based off of their full retirement age, not the earlier benefit, but not the later benefit?
The widow or widowers, but that doesn't grow till age. That's your own benefit that grows. That for every year you wait. That doesn't work with widow or widowers or spousal benefits. That just works with, and if your spouse is alive, what you get, let's say your spouse is getting 124, 132% of their benefit, and you file for spousal benefits because you were born before January 2nd, 1954, what you're going to get is 50% of their benefit at their full retirement age. You don't get that extra 24 or 32% because they delayed taking benefits until 70. You only get that if they pass away. Then you get the full amount, including that extra 24 or 32%. But while they're still alive, you get 100% of their benefit at their full retirement age. So if I took, if my benefit at 66 was $2,000, and at 70, it's like $2,400. Okay. And my wife files for spousal benefits at her full retirement age under me. she's going to get half of my 2,000, not the 24, not the extra 400 that I was getting added to my 2,000. She only gets that if I pass away. Then as a widow being full retirement age, she could get the full 2,400, the 2,000 plus the 400 extra that I earned by waiting to take my Social Security at age 70.
Thank you for clarifying that, because I think a lot of people, especially with disabled children or a spouse that wouldn't otherwise get benefits, they're definitely thinking about delaying till 70 because the spouse or the disabled child would get a higher benefit. And I just wanted to make it clear that it's based off of the full retirement age, because I think that is a common, definitely a common misconception on that. I'm going to let you keep going in the effort of time. We do have a lot of questions, but I'll let you just keep going, and I'll chime back in a minute.
So remember, I told you earlier that if you decide to take benefits early, retirement benefits, there is a limit on what you can make if you're still working, because it could have an impact on your Social Security if you're collecting Social Security and file for benefits early. So the limit is $18,960. This is for 2021 now. $18,960. For every $2 above that, your benefit is reduced by $1. The year you turn full retirement age, that limit goes up to $50,520 for the year. For every $3 above that, your benefit is reduced by $1. Once you reach full retirement age, all limits go off. So let's say I reached full retirement age in June of 2021. This year I have that limit of 18,960. If I make 28,960 gross this year, then half of that, that would be $10,000 more. Then half of that, or 5,000, is counted against my Social Security check. So if my checks were $2,000 a month, then for 2.5 months, my checks would be I wouldn't get them. So Social Security would collect that extra $5,000. But next year, let's say I turn full retirement age in June, between January and May, I could make $50,520. And for every $3 above that, my benefit would be reduced by $1. So if between January and May of next year, I don't make over $50,520, I could receive almost my full benefit and still make that amount of money. Then once June came of 2021 and I reached full retirement age, from that point on, I could be working and making as much as I want, and my checks will not be reduced at all due to my wages. All right, so how do I apply for retirement benefits? Online. That's the first thing you do. Try to do it online. Otherwise, call Social Security and make an appointment. Now, they have the 800 number here, which you're welcome to call. But waiting times can be long. I would suggest go to our website and get the number of your local office and try to make an appointment that way. Then that will be, your waiting time will be shorter. And of course, the application will be by phone. Somebody will call you on the phone, ask you the questions, and then ask you to verify either electronically or through the mail, probably electronically. But the third option, applying at your local Social Security office, is not an option currently for filing for benefits. All right, so what happens if you pass away? Widow or widower can collect as early as 60, but if they're working, that may have an impact until they reach full retirement age. If you leave a widow or widower who's at least 50 and they have a serious disability, and that disability occurred within 7 years of your death, they could get disabled widows or widowers benefits as early as 50. Now that percentage is 71.5%, like it is for a widow or widower who's not disabled at age 60. If your spouse passes away and you're not yet 50 or disabled, or 60 and not disabled, then you could get benefits under your spouse until your youngest child turns 16. But remember, if you're working, that might impact the amount you get, but your children get benefits until 18 or 19 if they're in high school, or past that if they have a serious disability. Now with a widow or widower, if you remarry after age 60, let's say you're collecting under a deceased spouse, and then you get married and you're over 60 years old, remarried, and you can still continue collecting under your deceased spouse. Because normally if you're collecting benefits like under an ex and then you remarry, you can't get benefits. But if your spouse or ex dies, then it's a different, and you remarry at age 60 or later, then that's different. All right, so let's talk about disability. If you have a physical or mental condition that's going to keep you out of work at least a year, it has to keep you out of work at least a year. It doesn't have to have lasted a year. It has to have lasted or be expected to last at least a year. Then you can file for disability benefits. As I said before, disability pays you the same as though you were full retirement age. And a lot of people, when they think about Social Security, they just think, disability, or it's not going to happen. I'm healthy, but things happen. Okay, you see what's around us with this pandemic and stuff. We've already had our oldest son that was on disability. He's off now because he's in remission, but he was getting disability benefits. Statistically, 1 in 4 young people will become disabled before they reach full retirement age. 1 in 4. 1 in 8 won't make it to full retirement age. So, it's just something to keep in mind. Hopefully, you'll make it to retirement age intact. But in case something happens, here's, this is what we have available. Now, even if you meet the disability requirement, what are the disability requirements? We have a manual that we use called Disability Evaluation under Social Security. Long title. Let me give you the nickname, Blue Book, like the color blue, Blue Book. All right. If you go to socialsecurity.gov and under search, type in Blue Book, you will see the manual that we use to determine whether or not a person is disabled. But even if you meet those requirements, if you don't have enough work credits, you're not going to get disability benefits. So what are the work credits? If you're over 31, you need at least in the last 10 years before you got sick, at least 5 years, or in other words, out of a possible maximum 40 credits, you need at least 20 credits to be eligible for a Social Security disability. But in some cases, even more than that in the 5 years, you might need 6, 7, 8, or 9 years of work in the 10 years prior to you becoming sick in order to qualify for disability. And of course, you have to meet the standards that are in that Blue Book. Okay, now for younger people.
Can you pause and talk about the self-employed and whether or not they're paying in or not paying in and that whole 10-year thing? We did have a question about self-employment earlier and
well, as long as they pay in, and they have their 40 credits, they're good. If they didn't pay in, there's nothing we can do for them.
And this is something where from a financial perspective, it's good to go ahead and pay yourself a salary. I mean, from an IRS perspective, if you've been in business for a few years, then you should be paying yourself a salary anyway. But as you're paying yourself that W-2 salary, you're also paying into Social Security. So that is one way to fix that if you haven't been doing that.
And also, if you are working with your spouse, please make sure that you're reporting those earnings as husband and wife, that both of you are working, because in the past, it's just been done under one spouse, and then the spouses get divorced or something, and the other one is kind of left holding the bag and stuff with no work credits at all when he or she was part of that business, but they just decided for convenience sake they were just going to report under one spouse. Not a good thing. Okay. All right. So disability, like survivor, like retirement, also pays benefits to your spouse if they're at least 62 or under and caring for kids with a disability or caring for kids under 16. The children get benefits until 18 or 19 in high school, or past that if they have a serious disability. All right, disabled adult child. As I told you before, if you have a child with serious disabilities, now if you're getting benefits or your spouse is getting benefits, any type, or you pass away and you had enough work credits prior to your passing, your children get benefits normally until 18 or 19, but then they're cut off unless you come back to us and say, when they're about 17 and a half, and say, hey, this child has a serious disability which began prior to age 18. Fill out a disability report. I'm sorry, prior to age 20. You fill out a disability report. If it's approved, then your child is classified now as a disabled adult child. Okay, it's a disabled adult child, even though they're past 18. they are eligible for benefits for life as long as they're single. The disability continues. All right. Now, what happens is after 2 years, they come on Medicare, not Medicaid, but Medicare. All right. So just like a senior, anybody who's on Social Security for 2 years, Social Security disability gets Medicare regardless of their age. All right. Do you have to pay taxes? Okay, go ahead.
In this example, so it's adult disabled child with the disability starting to, prior to age 22. So we really educate all of our families because their kids mostly don't qualify for anything prior because they had too much assets, they made too much money, etc. But once your child turns 18, as it relates to SSI, it's based off of their income, not yours.
Yeah,
but
well, we're getting to SSI. We're still talking
okay.
about Social Security. So with Social Security, we don't care what kind of assets they have. Okay, so they can have $1 million in the bank. We're still talking about Social Security. So that's not a factor. This is not SSI. This is SSI.
But what I want to ask is on that example of this adult disabled child, and the parent isn't retired and neither parent is disabled at this point, can you talk about the importance of them establishing their child as an adult disabled child, even though the parents might not be getting retirement benefits or disability benefits at this time?
You mean with Social Security?
Yes.
We would not make any decision concerning that child unless they were filing for the other benefit, meaning SSI.
Okay.
But otherwise, if the child doesn't qualify for any kind of benefits from us, then we don't make a decision on the case. They would have to be filing a benefit for SSDI, which is Social Security Disability Insurance, or the SSI, Supplemental Security Income, which I'm going to come to in a few minutes. Okay, so we'll explain briefly the difference between those two programs. But what the parents could be doing is gathering the medical information and everything, because we have to establish that disability began before age 22. So make sure parents need to gather you don't have to have the medical reports, but we do need the names, addresses of doctors, schools, for the ARD reports and stuff. We do need to know, because we need to verify with medical sources and with the school that this child has been evaluated and this disability began before age 22. All right. So do you have to pay taxes on your Social Security? Most people do. If your modified adjusted gross income is over $25,000 and you file as a single person, or over $34,000 and you file as a couple, then you're going to pay taxes on your Social Security. Now you can ask us to pay taxes on your Social Security benefits. We can take out at different amounts, or you can stop it at any time and just say don't do it. But if you don't ask us to take that money out, we don't normally take out taxes out of Social Security benefits. So unless you ask us to, we won't. And at the end of the year, you'll have to calculate, or when you do your taxes, you have to calculate how much, if you have to pay something back. All right, let's talk about Medicare for a minute. Remember, I told you that full retirement age is anywhere from 66 to 67 for most people, or somewhere in between, but the Medicare age is still 65, all right? Now, anybody who's on disability gets Medicare after 2 years of being on disability. You might say, are there any exceptions to that? Yes, two. If you have Lou Gehrig's disease or permanent kidney failure, end-stage renal disease, then you don't have a 2-year waiting period. But everybody else who's on disability, on Social Security disability, has to wait 2 years before they come on Medicare, unless they turn 65 before the 2 years are up. But usually that's not the case. Usually people on disability are younger than 64. So, they would normally have to wait longer than 2 years to come on Medicare. So if they are getting some type of disability benefit, no matter what their age, after 2 years, they come on Medicare.
Is it exactly 2 years? Someone in the chat
24
box
months.
said,
You have to be getting benefits for 24 months. And then
Okay.
the 25th month is when you become eligible. You're entitled to Medicare. Now,
Got
if
it.
you're getting benefits, we're automatically going to sign you up for Medicare A and B. So if you're on disability, prior, maybe about the 22nd month, you'll get a Medicare card through the mail, and it'll be effective the 25th month that you're receiving benefits. If you are getting benefits, if you are not disabled, not getting disability, and started getting benefits early from Social Security, then we're automatically going to sign you up for Medicare at age 65. You don't have to do anything. That card is going to come through the mail, and you're going to be signed up for Medicare A and B. However, if you are not receiving a Social Security benefit, okay, at 65, or prior, when you are about to turn 65, we're not going to automatically sign you up. All right. So if you don't sign up at 65, there could be consequences. And I say could be, not necessarily will be. And the reason is a lot more people are working now at age 65. So if at 65 you are working and have health insurance through your employer, or you are covered under a spouse who's working and you are on their employer health plan while you are still working, or your spouse is still working, you're covered, so you don't have to apply during the initial enrollment period. The initial enrollment period is for people who at 65 are not working and or are not covered under a working spouse through the employer. So the initial enrollment period is the month you turn 65, 1, 2, or 3 months before, or 1, 2, or 3 months after. So that's 7 months. Okay. Oof. I have my fingers are anyway, 7 months, because it's the month you turn 65, 1, 2, or 3 months before, or 1, 2, or 3 months after. So that should turn out to be 7 months. So, but that is for those that are not working at 65 and or are not covered under a spouse who's working. Now, if you are working at 65 and and you had health insurance through your employer or your spouse's employer, and that's the reason you didn't file during the initial enrollment period, you get the special enrollment period. The special enrollment period is 8 months after you stop working or your spouse stops working, if you're on their employer health plan, to file for Medicare without a penalty. So if you miss the initial enrollment period and you miss the special enrollment period, then you can only file for Medicare during the general enrollment period, which is January to March of each year. So if, let's say, I stop working in January, and okay, I had 8 months to file. Let's say I'm 70 and I didn't file starting February, because the 8 months start the month after you stop working. So 8 months went by and I didn't file for Medicare on using that special enrollment period. Well, now, let's say I went to my doctor and I've got all these health problems. I said, oh boy, I better get some kind of health insurance. Well, so I said, I better sign up for Medicare. I heard it's open enrollment. Well, that's not open to you because you missed your initial, which was okay because you were still working. You had the special, okay? In my case, let's say I had the special, but 8 months went by. I missed that. So now I can only file during the general enrollment period, okay? Which is January to March of each year. So if I try to go to Social Security now, they're going to turn me away and say, we'll see you in January. So I come in January, and let's say I'm 70 years old. Well, guess what? For every year I was late in signing up for Medicare Part B, my Part B premium is 10% higher. So 5 years late, my premium is 50% higher. Had I filed within 8 months of stopping work, I would not have gotten that 50% penalty. But because I let the 8 months go by, and now I can only file during the general enrollment period. And if I don't file for Medicare by March 31st of 2021, I have to wait till 2022 to file for Medicare. And then it'll be, instead of being 50%, if one more year passes and I'm 6 years, it'll be 60% higher. And that never goes away. All right. So those are the 3 enrollment periods: initial, special, and general. Again, if I come in at 70 to file for Social Security, normally the Social Security worker might think, well, this guy's going to get a 50% penalty. But I say, hey, I know I'm 70, I'm 5 years late, but I've been working. I just stopped working 3 months ago. Hey, cool. That's within that 8 month special enrollment period, I don't get a penalty. All right. So please keep that in mind. All right. So let's talk about the different parts of Medicare. A, B, C, D. All right. A covers the hospital. If you have your 40 credits or quarters, you have Part A free. All right. So that means the first 60 days in the hospital is covered, but you do have a deductible of $1,408. I don't know what the deductible is for 2021 because Center for Medicare Medicaid Services has not released that information yet. So I apologize, but this is still for between now and December. That's the deductible you have to pay. Next 60 days is covered by Part A, but that only covers hospital stay. You want medical coverage, that's the one that costs you. That's the one that assesses a penalty if you're late. All right. So Part B premium is $144.60. If you get Medicare prior to filing for Social Security, you generally are billed quarterly, but there's a way where you can have that billing done monthly. But it's $144.60. If you're collecting Social Security, we will take that money out of your Social Security check automatically. Now that covers 80% of your doctor bill after you pay the deductible of $198. So if your doctor charges you $50 a visit, after 4 visits, you've met your deductible. So on the 5th visit, you only pay 20% of that $50 that he or she would normally charge you. So after you've met the deductible of $198, and again, this is for 2020. I don't know what the 2021 figure is going to be. After you've met that deductible, then you only pay your doctor 20% of what you normally would pay him. Okay, so that's hospital and doctor. That does not cover prescription drugs. If you're in the hospital, then your drugs are covered under Part A. That's okay. But once you come out, you don't have a prescription drug plan. So if you want prescription drug coverage, you have to sign up for Part D. Now, A and B, Medicare, you come to us, you come to Social Security. We can sign you up. You can go on the website. That's the easiest way. Do it online. Otherwise, give us a call and we'll help you sign up for Medicare A and B. So if you have A and B, if you want a prescription drug plan, you need a Part D. Now, Part D is administered through private plans, not through Social Security. So you either call 1-800-Medicare, and it's a 24/7 service. So if I were you, I would call them after 5 o'clock this evening or any evening, okay? Even call them on weekends. 24/7 service. Don't call during the day because the waiting time is long. But call in the evening or call on weekends, you shouldn't have a long waiting time at all. All right. So if you want a prescription drug plan, you can go to Medicare.gov, click on Plan Finder, put in your medications, put in your zip code, and it'll give you the 3 most economical plans. Or you can talk to somebody at Medicare, 1-800-Medicare, and they can tell you that information. Or you can go to plan provider. But if you go to one of the Part D plan providers, just know that they're going to try and sell you their plan. They're not going to give you comparison of the plans. They're just going to tell you, well, this is the best plan you could sign up for. Whereas if you go to Medicare, either online or talk to somebody, they can do a comparison with you of the plans. But you can do whatever you want. Now, some people might say, is there, because Part D, the premium is about $32 a month, and there's copays and deductibles. So you might say to yourself, is there something that has A, B, and D all blended in? Yes. That's Medicare Part C. That's called Medicare Advantage Plan. Okay, Medicare Part C Advantage Plan can be like an HMO type plan. If you take the HMO plan, then you can drop the Medicare Part D. All right, because you won't need it because your Part C plan will have it built in. So that's going to be a money saver. All right, of at least $32 a month, and then the other copays and stuff, depending on what your Medicare Advantage plan charges. So Medicare Advantage plan, that takes in A, B, and D. So in most cases, so you can, if you take an HMO type plan, just know that if you do that, you will have to use the doctors in the network. They also have PPO plans. Now, if you take the PPO plan under Medicare Part C, then you have to keep your Part D plan, or you have to pick a Part D plan because the PPO type plans don't include drug coverage, but the HMO Medicare Advantage plans do include drug coverage.
And
right?
sometimes on the Medicare Advantage plans, it may or may not be in your best interest to have an Advantage plan. For instance, with my own daughter, we chose not to have a Medicare Advantage plan because it really limited who we could see because there's a network, right?
Right.
So we wanted to keep the flexibility to go where we needed to go. If we wanted to go
Right.
to MD
Right.
Anderson or see the doctors and the specialists that we need to see. So we chose against an Advantage plan. And sometimes an Advantage plan can be really fantastic for a person, and sometimes it's not the right fit at
That's
all.
right. But
So it's
remember, Allison, that there are times when you can change from one plan to another or go back to original Medicare. So
yes,
you're not stuck
yes.
forever in the Advantage plan that maybe you don't like or doesn't work for you.
Right. You can definitely try it. And for us, like I said, for us, it was just a matter of we knew for sure that those doctors weren't in network or we'd have to switch. So that was just kind of a no brainer for us. Like we didn't even want to try it for that reason.
Now
But
those,
everybody's separate.
right. Now, those that have traditional Medicare, there were co-pays there and deductibles. You can get a Medicare supplementary plan, but the supplementary plan doesn't work with C, only if you have A and B, which kind of fill in those gaps, which those plans don't cover. But they can be expensive, and you have to be signed up for A and B first, and then you can get one of those supplementary plans if you want. Or like I said, you can try a Part C plan and see if that works. But as Allison said, in many or most cases, you're going to be in a network, so you're going to have to use the doctors in network. So maybe the specialists and doctors that you need are not included in the network, so you might not like the way those other, some of those other doctors that are in network. You say, oh no, I want to stay with my original. So
I would just like to chime in on that too. On the Medicare Advantage plans, they're right for the right people, and the supplement plans are right for those people. The supplement plans are definitely more expensive. An Advantage plan could be free or relatively cheap, and a supplement plan is going to be more expensive. But one of the cool things on the supplement plan is you've got freedom of choice, which means that you can go to any doctor that accepts Medicare. So that's a beautiful thing, in my opinion. The other thing with the Medicare supplement is something that is important to consider. I just want to say this, this matters, that when you turn 65, you pretty much have an open enrollment into a Medicare supplement without proving to be insurable. So even if you're super unhealthy, they're not going to rate you and they're not going to decline you for a Medicare supplement. But if you wait and try to do it in the future to go to a Medicare supplement, it is possible that you would either pay a higher rate or you wouldn't be able to get it. So careful consideration as you're approaching 65, and working with a professional and talking to a professional through these things is definitely what we recommend, just so you can make a decision, a very informed decision. And it's confusing. So if you looked at this and you're a little cross-eyed or whatever, it is confusing. And even after you've studied it a lot and you go to the Medicare the website is even more confusing. You're not alone. And there's definitely a lot of professionals out there that can help you.
Thank you.
I know we're over time, Andy, and I guess is this your last slide?
Well, I was going to give a slide on SSI, but
okay, I want you to do that. For those of you that have to go, we understand. I do have a few more questions. I want you to go through the SSI. For those that you have to go, we'll send you the presentation. And then there was just a few more questions that I wanted to make sure that we answer at the end. So thank you, Andy, for your time.
Okay. So SSI stands for Supplemental Security Income. Does not come from Social Security funds. It's for people who are 65 or older, or those that are younger than 65 who are blind or disabled with limited income and limited resources, which is like assets. Okay. So it doesn't come from the Social Security fund. The maximum amount in Texas is $794 for next year. I believe it's like $783 for 2020, and it's going up to $794. Now, if you're eligible for SSI, or your child is, you're eligible for Medicaid, unlike the Social Security disability, which provides you for Medicare. There is no 2-year waiting period to come on Medicaid. All right. Now, the amount of SSI that you get, or your child, assuming this is a child with disabilities, gets, depends on any other income that they have. Okay. The SSI cannot be received outside the US, right? Because it's an assistance program. Social Security can be in most cases, not SSI. The SSI check comes on the first of the month, and the maximum amount is $783 this year and $794 next year. But that depends on your living arrangements and other income that your child might have. All right. Now, this is frustrating for a lot of parents because they have a child which obviously meets the disability requirements that you might look at in that blue book, and then they come to Social Security and they're denied. Okay, why? Until your child is 18, income and assets or resources of parents count as though they were the children's, right? So all that income and assets are a factor until the child turns 18. Once the child turns 18, even if they're still living with mom and dad, even if they're totally dependent on mom and dad, that doesn't matter. We are now treating them like an adult. We're only counting that child's or young adult's income and assets. So don't be frustrated if you've been told that, your child can't get SSI now because the parent income is too high. Remember, at 18, everything changes. All right. And with the SSI program, since it is assistance, you got to let us know. If you move to another state, Texas Medicaid is not good in another state unless your child is there on a visit. If you're moving to another state, you need to let us know the month of the move so that you can get a Medicaid card from the new state that's effective the month after the move, because otherwise Texas Medicaid won't cover those expenses, all right, after you move. So make sure you let us know. Make sure you let us know you change address, income, resources, household composition, marital status, because all these things could affect your child's or your young adult's ability to collect SSI or the amount of SSI they get. So all these things are a factor. So this has a lot more rules and regulations because it's a different type of program. Again, this one comes on the first of the month. The Social Security checks come on a Wednesday, second, third, or fourth Wednesday, depending on what day of the month you were born. All right. So that's it. And I guess we'll open it up to any other questions that you might have. Thank you very much for your time. Or Allison, you might have another slide that you want to share with people.
I have several questions, and I'm gonna get to those. Can you talk about the household maximum? So, like in the example that you've got a spouse, and then you've got so the guy's getting retirement, then his spouse getting 50% of his benefit, and then he's got an adult disabled child. There was a question about what the household maximum is and how that works.
Right. It's usually 150 to 180% of the person's benefit. That's the family maximum. So, I can't figure it out in my head, but just go to the website and put in under search family maximum, but it's about 150 to 180% of what one person's benefit would be, and that's what the family maximum would be. So I guess if somebody were getting let's say $2,000 a month, the family maximum might be something like $3,500 a month. So that means the person who's disabled or retired would be getting their $2,000. That $1,500 would be divided up among those that are eligible for the benefit, the eligible children. So, and the spouse. So the total couldn't be more than 150 or 180% of what the original benefit was to the person that was eligible for benefits. So that's how that's how it works basically. That's the simplified explanation about how the maximum works.
Okay. Can you talk about Medicare's income related monthly adjustment amount, Irma?
Yeah. Okay. Remember when we looked at the Part B premium for the Medicare, it was $144.60, right, per month. All right, some people are paying more than that, and some people say I'm paying a lot more than that. Okay, if your income is after deductions and after expenses and everything, if it's higher than $85,000 and you file or 87, I'm sorry, and you file as a single person, or over 174,000 and you filed as a couple, then your Medicare premiums are going to be higher than that $144.60, that Medicare Part B premium. And depending on how much higher, how much over it is, the 85,000 if you file as a single filer, or 87,000, or 80 or over 174,000 if you're filing if you file your taxes as a married couple, then your Medicare premium could be maybe $200 a month to $210 a month, depending on what you're. Now, if so your premium for 2020 is based on information that we got from IRS. Well, when we determined your premium amount for 2020, that was at the beginning of the year, you had not filed, nobody had filed their 2019 income tax yet. So actually your 2020 Medicare premiums are based on your income for 2018. So a person that maybe had capital gains in 2018 because they sold a house or whatever, or liquidated business, whatever, they maybe 2020, they're paying a lot more premiums than would be normal. But if that went way down in 2019, then that means that for 2021, their Medicare premiums are going to go down. So generally, the current year premium is based on what your modified adjusted gross income was 2 years ago. So 2021 will be based on your income tax, what you reported in 2019, right? So now can there be changes in a person's, if there's a drastic, if you lose your spouse or lose your job, you should contact Social Security, because there are certain changes that might actually affect your premium for the current year. Okay, so if those happen, if those kind of changes happen, then contact us, or if you're not sure, contact us, and we'll see if we can adjust your premium for the year. Otherwise, again, the premium for the the Medicare Part B premium and the Part D premium, they will be based on what for next year, for 2021, they will be based on your income tax returns for 2019, which you filed at the beginning of this year, at the beginning of 2020.
Okay, on that same vein, if you had an adult disabled child that was getting SSI and then switched over to SSDI whenever their parent retired or became disabled, and now they're eligible for Medicare, does that child that was dual qualified for SSI and SSDI, are they eligible for extra help or getting help with their Medicare premiums or their prescription premiums?
Well, again, it depends. That's through the state, and the extra help that you would have to look, you would have to go to the Social Security website and under search type in extra help, because the amount changes every year, and see what the income amount is. If the income amount is less than whatever the limit is, then the person would be eligible for like QMB, which was qualified Medicare beneficiary, where the state would pick up the premiums like they were doing before. See, if you're a dual eligible, if you have Medicare and Medicaid, Medicaid is paying for those the deductibles and copays and premiums on Medicare. But once you lose the Medicaid, if your child is no longer eligible for Medicaid, then you could see if they qualify for extra help. Now, I believe if they qualify for extra help, they also qualify for that as a Medicare assistance where the state would pick up the cost of the premiums and copays on that if they are eligible for extra help. So,
and I think you can call 211 again early in the morning or late at night. It's a good time to call them. I think you can get more information on that out there as well. We have a question, and this was from a while ago, a lot of slides ago, Andy. But does work for the purposes of reduced benefits mean income, as in dividends, interest income? Do they count?
no,
Or does it just mean
no,
actual
wages.
Except for the example of the, so, but pension income in the example of TRS does count. So that's the one-off, right?
Yeah.
So except for the TRS and the railroad, then it's based off of wage.
But the
wage
TRS
income.
doesn't count toward that $18,000 limit or whatever if the person is collecting prior to full retirement age. We're not using that in determining their wages. We use that when we calculated their Social Security, but not their ability to collect Social Security. That for wages, we only count income earned from work. So it has to be, meaning the person is working and receiving a salary. Okay, not a pension from their former place of work. That's not in that limit of that 18,000 whatever or 50,000 that's going to be for next year for the year you turn full retirement. That's not counted as toward that limit. Only wages are counted toward that limit. But it is counted in calculating what the person's monthly benefit is going to be. Now, if I retire and I'm getting a check from I'm getting a pension from TRS, I retired with 25 years of work, earning substantial earnings in a place that paid into Social Security. First of all, that windfall is not going to be as great because I have over 20 years, I have 25 years. If I get another job paying into Social Security, it's possible that in 5 years, when I have my 30 years of substantial earnings, I could be then free of the windfall. Then windfall could go away completely.
Does the windfall affect disability? So we've talked about retiring, but does the windfall also, affect if you're disabled?
Okay. If the person was getting a check from TRS, yes. Mm-hmm.
Okay. I'm sorry, I'm just reading here.
Okay. I saw Leslie Lawson put in a comment about the Pickle Amendment. If your child is on SSI and Medicaid, and now they become eligible for SSDI because under a parent, okay? And so the amount of SSDI is going to throw them off of SSI, then there is a provision under the Pickle Amendment where that child or that young adult can stay on Medicaid as long as they keep the SSI rules. As long as you make believe they're still on SSI and keep all those rules for the SSI program, we can still keep them on Medicaid. And after 2 years of being on SSDI, they will get Medicare. So if they stay on the Medicaid, then the Medicaid will pay the premiums, deductibles, and copays of Medicare. If they choose to drop Medicaid and just stay with Medicare, then they won't ever have to worry about how much money they have in the bank, how much they give toward household expenses, how many people live in the house. That does not count anymore because they're not getting SSI and they're not on Medicaid. But as long as they're on Medicaid, they have to keep the SSI rules, as though, even though they're not getting an SSI check, but they're still technically on SSI, and this keeps them on Medicaid. Right,
okay, let's take two more questions. Any additional questions? We've really tried to answer as many questions as we can. You can feel free to email us or reach out. When it comes to a cap on Medicare premiums, is there such a thing on a cap as to a cap on Medicare premiums?
Yeah, but I can't tell you I think it's maybe about $400 something a month or something like that. But
All I
Your
can tell
income
you-
would have to be, wow, really a lot more, I think, to be at that if, at that rate, but.
all I can tell you is that the rates for health insurance in the independent market, like if you're buying your own group your own health plan for your family, I know that I have a lot of self-employed that have had to purchase their own insurance and things like that, and it is a walk in the park. They are so super excited to move from that to Medicare, and even buying a supplement plan, they're still saving a ton of money a month as opposed to what they were paying. Okay. And here's the last one. I know we have a lot of families on here that that are contemplating retirement and also have a disabled child. Does continued child support to an adult disabled child affect SSI eligibility? And the answer is absolutely. Yes, it does. And you should have that child support directed to a special needs trust, so it does not affect SSI. And I recently heard that, like, if your child support is through Texas, that obviously you work with an attorney, we can refer you to one that's going to set up the special needs trust. Once that trust is set up, then you can set up a special needs trust bank account, and that you can go into the state of Texas website where you manage your child support and simply change the bank account where it goes. It worked for a client. I know for a fact that it worked for a client, and it was free for them to do. The other way you can go about it is hire an attorney and get your child support directed to a special needs trust, as opposed to the way it is. But it can definitely mess you up, and you definitely need to get that changed if child support is continuing past age 18. So it's an important conversation, but there might be some easy ways to do it that are not ridiculously expensive. And so the last thing on that is, if you are in the midst of divorce and you have a special needs child, let's have these conversations sooner versus later, because it's easier to get it set up that way on the front end than to go back on the back end. It's easier and cheaper. But you definitely want to maintain your child's eligibility, and that one little thing will definitely throw it off. Andy, I want to thank you. You have given so generously of your time today, and definitely gone over. I appreciate the time that you have given us. And I wanted to just thank everybody for being here today. If you have additional questions that we didn't get to, certainly please just reach out, and we will get them answered just as quick as we can. And thank you again, Andy, for
My
always
pleasure.
being amazing.
Thank you for inviting me. God bless you.
All right. Have a great afternoon, everyone.
You too.
Bye-bye.